guys, welcome back to my channel. Happy New Year. I hope your year started well. And for this New Year special, I decided to come up with a very important topic today, which is healthcare services in Canada. So let's get started. So the very first thing you need to do after you land to Canada would be to get registered for a healthcare card. Now, if you land in other provinces other than Alberta, you still need to wait for 3 months before you can get a healthcare card. But the best thing about landing in Alberta is you can get your healthcare card almost immediately. You just need to go to a registry and you need to have your government issued ID with you, your utility bill or your bank statement which has your address written on top of it. You should have an evidence of that document and fill out a small application in any of the registries, and they will give you an interim healthcare card. Go to a doctor immediately that day itself, and the actual card will be mailed to your address within 5 to 10 business days from the day you applied. So that's the way to do it in Alberta. Once you get a Alberta registered healthcare card, the next thing to do is to look for a family physician. Now, in countries like Bangladesh, India, Pakistan, and the Southeast Asian countries, you basically don't need to do this step. You go to a doctor which is available and you pay for your visits. But in Canada, you need to have a family physician, and that family physician will be first doing the general checkups to see what's wrong with you or what tests you might require, and then if your condition is serious, then they will be referring you to a specialist. You can't really go to a specialist by yourself. You need to go to a specialist via a family physician. They will be the ones referring you to a specialist depending on how serious your situation is. So the wait time can vary from weeks to months depending on how serious your condition is, and if it's serious then you get the appointment with that specialist almost immediately. If it's not that serious, then the wait time can be months. But to determine which family physician you should have, so there are many ways in getting a family physician. Number one, you can call the Health Link service, which is 811, and depending on your condition, the nurse on the phone will be suggesting you places nearby for family physicians who are accepting new patients. Number two, you can also go to walk-in clinics without any appointment, and you can go and show a doctor immediately if your condition isn't as well as it should have been, but it's not that serious, but you still wanted to do a walk-in without any appointments. There are a lot of walk-in clinics available throughout the city. You can go and show a doctor almost immediately with no appointments. And number three that you can do is to go to the nearest clinic from your home and see if there are any family physicians available, and see if they are accepting new patients, and just have them as your family physician, and later check their reviews in ratemds.com. If you like the family physician, you can stick with them. If you don't like the family physician, you can always change to a different family physician, but they need to be accepting new patients. And if they are accepting new patients, you can always change. So you're not bound to be staying with that one family physician. If you don't like the family physician, you can always change that. After getting a family physician is to see what is actually covered for you. Now, there is this myth that Canadian healthcare covers everything for their residents and citizens, but that's not completely true. So there is a 70-30 ratio going on in Canada. So 70% is covered by the government and 30% is covered by private insurance plan, or it has to come out of your pocket if you don't have any insurance plan. The healthcare in Canada is pretty good because we the citizens are paying taxes. A portion of our money goes to taxes, quite a huge portion actually, and the government uses those tax money to provide us better healthcare. So that's why we have a lot of things covered in Canada compared to rest of the world, but it's still not 100% coverage. So doctor visits are covered. If there are any lab tests which are given by the doctors, those are covered. If you require immediate surgery, those are covered. But the things which are not covered are your prescription drugs. If you need to go to an eye doctor, so optometry is not covered, dentist is not covered, podiatrist is not covered, dietitian is not covered, chiropractic is not covered. So the other things which are not essential, those are not covered. So just the essential things like visiting a doctor and going for lab tests, if you are needing a surgery, those things are covered. And the way what Canadians do over here, they usually have a private healthcare plan which will cover maximum of the other services which are not covered under the government. So let's say dentist, eye, these things are covered by private healthcare plans, and these plans can either be given by employers. So one of the things you can ask your employer while you're being hired is if your health benefits will be covered in that job, and that's a really good way to have a healthcare insurance. If it's not covered, then you do need to buy a premium package, and they can be found as well. So for me, I don't have any healthcare coverage, but my husband has coverage for both him and me, and that's why I don't require to have any coverage. So even if one of your partners is getting a coverage, that's good as well. And we do have 80% coverage in the other things like eye, dentist. And just to give you an example, I did go to an eye doctor a few months ago because I needed new lenses. And normally lenses cost you $200, but since I had 80% coverage in it, I only had to pay $40, and the rest was covered through third-party insurance. And that really saved a lot of money, obviously, because I just had to pay a small portion and the insurance covered the rest. And that's why if you don't have insurance, then you do need to pay the entire amount, which is $200, and that's a lot. And it's best to get insurance at some point. Obviously, if you can't get private insurance through your job and you can't pay for your private insurance, another way would be to apply to government, but your income needs to be low. It needs to be in a certain range for you to apply for government benefits. So government will additionally provide specific plans for people who cannot afford private insurance, and they will check a lot of criteria. So there is Alberta Adult Health Benefit, there is Alberta Child Health Benefit, and then there is Alberta Blue Cross coverage for seniors. So these are based on how much you're earning per month, and based on your income you will be eligible on getting covered. If your income range is low, then the chances are higher, because then the government sees that you can't really pay for them. But of course, if your income is higher, then you can't really apply for this benefit and you won't be eligible as well. And then the next thing which you also need to assess is how urgent is your medical health services. So let's say if it's like really low, like let's say you just are having fever or headaches, and that may be or may not be due to COVID. So the Canadian government presses you to call 811 and to explain your symptoms over to the healthcare professional on the phone, and based on what they tell you, you should do the next step. But if it's like slightly more urgent, like it's not life-threatening condition, but it's medium urgency like asthma, infections, or pain, then it's best that you go to an urgency healthcare center, and the one in Calgary is South Calgary Health Center. So they take care of the urgent situations like asthma, infection, pain, but they're not life-threatening conditions, but they do require attention to it. And if it's of very high urgency, like life-threatening conditions, then the best thing is to call 911 and ask for an ambulance, or if you can drive or walk to an emergency department, go there as soon as possible and they will be attending to your condition and getting you hospitalized immediately. So these are the healthcare services in Canada. A lot of it is covered by the government, which is really good. Like, we did have to pay for our doctor visits even back home, and if there was any tests required, we had to pay for those. Surgeries, we could never think of getting out of surgeries without any pay, but over here, if it is urgent and emergency, it's all waived. The government takes care of it. So that's a really good thing. And of course, nothing in this world is completely free, and 30% of it you do need to pay by yourself, or you need to have a plan which will cover maximum of it and you pay the remaining part of it. So this is the healthcare services in Canada, and I hope it gives you some idea if you are a new immigrant immigrating to Canada and you didn't have much idea about how the healthcare services work here in Canada. This is a really good way for you to learn and you to get a good physician and hopefully get attention to these services immediately after you land. Another thing to note is if you are in other provinces other than Alberta, then you do need to have a travel insurance plan from before, because let's say if you get sick in the first 3 months, it's not covered for you. So it's best to have an insurance plan bought from before, especially a travel insurance plan which will cover you. And another thing I wanted to also mention is, suppose if you're changing province, so let's say you are moving from Alberta to Ontario or Alberta to BC, then you do have 90 days to shift to the new province's healthcare, and Alberta will be taking care of your health issues meanwhile. All the problems if you have in those 3 months, Alberta insurance plan has you covered, and because they always cover their residents, whichever province you are initially staying in, and this is the rule that they will cover you for 90 days. And in that 90 days, you need to switch over to the new province's healthcare and register for it so that you have yourself covered at all times. This explains everything which I wanted to discuss about healthcare services today. If you have found my video informative and useful, don't forget to hit the like button and subscribe to my channel if you're new. Don't forget to follow me on Instagram, and I hope you guys stay safe and are taking care of yourselves. Hope to see you guys in my next video. Till then, bye!